So that's kind of the beginning of what I want to bring to you briefly. Now, did anybody have any questions before I go off onto a tangent of this, that, and the other, A, B, C, D, and E? Anybody want to throw
prostate cancer?
Does intake have anything to do with it? And you had a question too?
Going through the records, that's the only way you can test for prostate cancer?
And is going through the records the only way to test for prostate cancer? Any other questions maybe? Think about them, have them, roll them around, and I do have my contact information on here, so if you have a question or any of your family, friends, enemies have questions, direct them to me and I'll help. So, first question, does food and diet? Yes. Yeah. A lot of what we expose ourselves to, take in, can impact how we feel. We can, there's that saying that we are what we eat, and those kind of adages. I really strongly believe in that. And so, yes, you can eat things that will maybe make you gain weight, for example. And by gaining weight, you might not even feel that it's a need to check, or you might not even notice that there's another kind of growth someplace, like a tumor, right? So yes, foods that you can eat might make you gain weight. Why are we laughing over here? You laughing?
You're talking to them like it's affecting them. You should be looking at us. And we're feeling attacked right about now. Bad enough you keep pointing.
I know, right? Who's asking the question?
Amen.
Amen. That are concerned about their men. So, they're trying to protect their investment. So, yes, the things that we eat.
Amen. Protect your investment.
Yes. The things that we eat
Where your badass kids at?
Our ability to
At home.
heal ourselves.
Where they need to be.
Our ability to prevent those illnesses. I really like to push vitamin D, honestly. And we feel that we can get all our vitamin D from the sun. We can get some, but sometimes we do have to supplement our bodies with things like good, wholesome foods and some vitamins. So that is true. Another thing, so like things like tomatoes and sometimes things like soy products, okay, are shown to help prevent certain types of cancer. That is accurate. Another question was, is the digital rectal exam the only way to detect cancer? The answer is no. The digital rectal exam is actually only like about a third of the way to detect cancer. We can do it by blood. And someone said to me, wow, you can detect cancer by blood? I said, yes, you can detect cancer by blood. So you can detect cancer in part by doing that blood test, by doing the finger test. This is my finger test maneuver, by the way. I like to show you that.
I would do it.
Y'all like that? No. So anybody that's ever interested in going into nursing or healthcare, medicine, you can do the finger test. So the finger, and there is having the biopsies. So if they determine that there is something to feel and they want to do an ultrasound and the ultrasound sees something, then after the ultrasound we can do like a random or a targeted MRI biopsy. What is the finger? What is the digital rectal exam? The DRE is where someone, you have called your provider, your clinician, your nurse practitioner, your doctor, or your physician's assistant. They take the man and they place him on his side, and they take their gloved and lubricated finger, and they feel for the prostate. Now, to me, the prostate feels like a walnut.
Okay. All right. Okay.
like a walnut, and it's like a small walnut. And as the man gets older, the walnut gets larger. I actually, be honest, it's like a split walnut. So to me, it feels more like something like this. So,
Okay.
you know, and so when I take my finger and rub across it, I feel almost like two planes,
Good.
right? And so what I'm feeling for is something that is like a bump inside of
The plant. Okay. Okay.
So something that shouldn't be there.
Okay.
Right? And so as I'm rubbing my finger on it, it's not comfortable, one, because it's like a vulnerable position, right? Right? You're trusting that I'm not gonna take your secrets away from you and, you know.
Right. Right.
Exit only, right? No, it's not yours. Today for 5 minutes, it is not yours. It is ours, right? Just so, yes. So for about 5 minutes, it is our collective region. And so yes, we take and we just feel that, feeling for something that feels like it shouldn't be there. Because it should normally feel kind of like, this tip of the nose is kind of soft, you know, kind of rubbery. But if we feel something that's like a stone inside there, and then there's maybe complaints that, I don't know, I'm getting up a lot at night, or I'm concerned because my dad had it, or I'm seeing blood in my pee sometimes, right? Or even things like, you know, the prostate test number was high. So that gives us our diagnosis.
I'm going to be frank right here because we're women. Does this situation affect their performance? I'm being honest because as a woman, when you have a man and you're concerned about his health, that is one of the number one keys. The man is worried about his performance, and sometimes it affects different situations. So this is what I'm asking.
Right. So that's an excellent question, and I would refer a question like that maybe to a focus group of men that have undergone issues with their prostate, and maybe I would actually do the research myself before I can answer that question. But first, two things I would do. I would refer to a urologist and say, like, hey, doc, in your experience, do men that have prostate issues also have performance issues, yay or nay? And then before and after treatment and diagnosis,
Right.
Stuff, do they have performance issues? I do know this for a fact that getting a diagnosis of any sort can trigger mental health concerns, right? So let's just say I get an abnormal test. I'm going to go home and I'm not going to sleep tonight.
Right.
Right? So I'm going to have insomnia now. And then maybe my test results are questionable. And I got to maybe do these kind of tests, right? Or treatments. I might start to have anxiety and depression. So those kind of things can definitely impact a man's ability to perform, I would say.
That's exactly what it shows. And just not to be funny, because of course as women we don't have a penis. Right. We don't know how erectile dysfunction affects a man, mentally and physically. Right. It's a serious situation, and it needs to be discussed, handled with that. I mean, hey, we love our men.
Oh yes, we do. Our men, our brothers, our sons, our uncles, our buddies, all of that. Love them all. Our coworkers, and we want them all to survive and thrive and
how much you
be
want to
educated,
a lot of guys, including
right?
from America, that don't know, like they never had prostate check, and they like 30 years old.
It was an analogy that I got on the way over here, and it was like, that's a good analogy. So if you imagine a cage around, like this fence around here, right? But imagine it lower, right? But it's around the whole entire space. and there's a turtle in here, and then there's a rabbit in here, and then there's a bird in here. Those are kind of, if you think of 3 ways to look at types of prostate cancer, right? So we have some very slow-moving cancers that can't really escape the cage. We just watch them. Then we have some other cancers, prostate cancers, that are a little more aggressive. We gotta watch them because they might escape. They might get up out of the cage and go metastasizing onto other parts of the body. Then we have the bird type of prostate cancer that we really have to watch carefully because it can get up and it's out the cage, and we have to really aggressively manage that type of prostate cancer. So that's, a quick synopsis of cancer and how to detect it. There's things like also staging cancers, and that will determine how the cancer is treated. That can be a somewhat complicated topic, but I can always go over that topic. Did any questions kind of get generated in your brains?
So what's the age, like especially if you have history of cancer in the family? What is the earliest age? Because like women, for instance, health insurance won't do something unless you have first generation.
Right.
So for men, a lot of them don't catch the prostate until they're stage 4 or 5.
Right.
So what do we do at that part?
So the current guideline recommendation is to do a prostate specific antigen test and or a digital rectal exam beginning at age 40. Now some men maybe they had a first degree relative and they requested earlier. I strongly believe in advocating for yourself. I strongly believe in getting a second opinion, because let's say you had a first degree relative that died and you were like, you know what, I'm not waiting until I'm 40, right? Why should I wait till I'm 40? I know I'm using county insurance. I know this is Medi-Cal, but I want to get tested now. Sometimes, honestly, yes, like I said at the onset, the reason why we can't always get diagnosed is because of our type of insurance. But yeah, sometimes we still have to ask for a second opinion, advocate for yourself, demand, even if it's the least expensive insurance we can afford, still ask for another opinion within that system, right? And then maybe save up, buy a higher tier program, or save up and use another type of insurance program. Yeah, that's or pay out of pocket. One more thing is when you're getting diagnosed, don't get diagnosed by a generalist, because a generalist is not going to know how to read that biopsy accurately, right? Or a generalist is going to say, oh, well, that PSA number, it's okay, a 5 is okay, and you might have a history that, like if you're 35 with a 5 PSA, that's not okay. If you're 70 with a 5 PSA, that's all right, right? So a generalist might look at your numbers, look at your biopsy, and miss things. So you could be underdiagnosed, undertreated, then the cancer, comes back more aggressive. So, a quick mention about the incidents. Yes, an Asian and Pacific Islander, or our Asian brothers and sisters, they have about 11% rates of prostate cancer. American Indians have about 14% incidence of prostate cancer. Hispanic Americans have about 18%. Whites have about 20%, 20.5%, and African Americans, non-Hispanic African Americans have about 36% incidence of prostate cancer. So, yes.
As it turns out, my husband and his brothers have been diagnosed. My boys, should they be very concerned about that as far as maybe if it's hereditary or is it really restricted to just diet?
Excellent question. Genetics is sounds like it's a strong determinant in the family for cancer of prostate. And so what I recommend are tests like, there's a test called Invitae, INVITAE, and anybody can ask for that test. And that test will screen for about 90 different types of cancers. And if you have a first generation relative, they will give you additional genetic counseling on things to do. So it is a very desirable test to order. Again, it's called Invitae, INVATAE. Invitae.
Okay, hips, you sir.
Girl, I need no lotion. I didn't put no lotion on.
I'll look it up, but
You making me feel bad for that.
stay in touch with me. But so yes, that would be a test that I recommend because it can pick up all sorts of cancers, and it's pretty accurate. It's a blood test, very simple.
So you asked that of your primary care physician?
Yeah.
I want to have this test.
I want to have this test done. If they say they don't know what you're talking about, do not hesitate to reach out to me. Because a lot of times, really, we are given, this is off-label. So I'm not speaking about any particular drug or any particular health system. Like,
Right.
but what I'm saying is sometimes we are not given the most accurate information about what can be done and what tests can be ordered. And I'm here to tell you, you can have any and everything you want. All you have to do is ask for it. And then if they say no, then you just ask a different way. And if they still say no, then you have somebody else ask for you, like your attorney maybe, you know. But you can get anything you want.
Any recommendations on treatments?
Treatments, yes. So treatments are kind of guided by the stage of and type of the cancer. So the treatment for that little turtle, that slow-moving turtle that can't get out the cage, we just kind of watch him. Just watch him. We repeat the blood test. We might do, it's like the symphony test, right? We kind of do the...
It's really, you're supposed to go like this, right?
Right. And yeah, there's a lot more to it. Right? There's sign of consent, you know, that you don't get mad at me afterwards. But yeah, so there's lots to monitoring. So you don't just say, well, I'm going to watch you, but we watch you, we repeat the lab test, we touch the prostate again, and we make recommendations like changing your diet, maybe becoming, if possible, more active, things like that. For those other cancers, sometimes, yes, there's surgical removal or partial removal. Right. And there's things like radiation. There's also things like immunotherapy.
Okay.
So there's treatment options, lots of treatment options.
So what determines the stages? How do you know the stages?
Excellent. Question I was waiting for all afternoon. Not. No. So what determines the staging is having that expert look at the blood test, the digital exam, and the biopsy, and then you get what's called a score or a scale. There's something called a Gleason, like Jackie Gleason. Mm-hmm. There's also something called an Epstein, like that other guy. So there's those scales, and they take numbers, and with those numbers they say, okay, this is your number, this is the recommended therapy for you, and then you say yay, nay, second opinion, right?
What suggestion do you have for the person taking care of someone that actually has it, the wife or the baby? What suggestion do you have for them to handle the person that does that?
I would recommend, I would say support group. I would say because the support group is really going to help you get aware of what they're dealing with, what that person might be dealing with, because you're going to hear it from a couple other perspectives of what they're also going through. So awareness of, I would recommend that the caregiver become educated on the disease and what that patient is going through. The support group also, and then respite. So meaning take a break, meaning get somebody else to do this, even this afternoon, even this every Friday. I highly recommend that. Yeah. Other questions?
Yes. We can hear you.
Why you gotta stand up? Nobody
We want to hear you. We want to hear you.
Stand up, state your name. Somebody was Freddie, so like 3 years ago, so I'm Freddie. I'm Freddie. So it's essentially for rolling in prostate, because the father got this. I want to make sure. So we're 45 something. So 2 years ago, prostate.
How old are you? So, great anecdotal story, right? 58. PSA of 9. But it went up from a 3 to a 9. And then you had, was it a targeted or a random biopsy? You know? So when they did the biopsy, did they do it with guided imaging? So typically they're going to use something to guide where they're going, right? So they can go right through the core of that tumor cell. And on the flyer that I made, you can't really see the little tumor cell inside the prostate, but that's what they're trying to go through. They're trying to go right through the center of it. And when they go through the center of it, they look at the type of cell that's there. And the type of cell that's there will also help determine what kind of treatment is needed for this. So yeah, things like infection can also increase the prostate level. So if you have a urinary tract infection, that will make the prostate, the PSA number go up, right? So that's why it's not a perfect test. You can't just say, oh, this number was 6, he must have prostate. No, he might have a urinary tract infection, right? So repeating it in another time, right? And also, like you said, they did the biopsy and nothing was there. So sometimes that's why people say, well, why should I do the blood test? If it's inaccurate, then I have to go through that painful diagnostic treatment and nothing was there, right? So,
but it's about the peace of mind.
It's about the peace of mind, yes.
Because I'm knowing younger, and you look good for your age, just to say.
Yeah.
But I know younger men that are suffering this same situation right now, and of course they have changed their diet and have done different things, but it's still affecting them, and it's causing mental illness along with physical.
Yeah.
So.
Yeah. And so again, yes.
So you mentioned earlier about early detection, and so I've been getting my prostate checked like every year.
Yes.
Which means when my father died, I had medical 12, they lied and said my dad had a heart attack. So black folks knew about my health. After my dad died, I found out that it was actually prostate. So every single year, I get my prostate checked. My oncologist is like, hey man, why you gotta keep doing this? Like, I don't like doing this. Where you like when people just say stuff about it? But I'm like, why can't you PSA? PSA test will give you certain factors that blood you can see in the check. Every single year, I go. Every single year, I'm gonna go. Every single year, I post it, and every time I get rid of it. My thing is, especially for persons of color, we neglect our health a lot.
A lot.
Partially because we don't have money. And it's partially because you're very private and you just exist. So, I'm not going to sit here and lie and tell no man that it's not invasive. You won't get your car, you won't hug yourself after. But
Right.
there's going to be something that happens. And urgent attention from a lot of us. And me personally, I would recommend, if you don't know, still be urgent attention. And the reason is you may be in a situation like myself where my father had prostate issues. They did not tell
you. Right.
And then I found out, luckily, before I turned 35, that that's what it was. Matter of fact, on the 13th of next month, I'm going again.
Yes.
And I'll be posting again. So
Yeah.
that's
The
something
symphony
we should
test,
all
right?
Right, right.
And so that's a great point before we shut it down and wrap up. But there are people that actually don't know their family history. So there are people that are adopted. I have patients all the time that tell me I don't know any of my family history. So we have to think about other reasons why our people are not always diagnosed in time, and what we can do to support those people that are at risk. Any other last questions? Don't forget on this here flyer. On this here flyer, by the way, you will see that there's a website address at the very bottom of the center one. It says tinyurl.rx-refill. You might need a refill of some sort, like a blood